Find out why this patient was completely botched and what steps you can take to prevent the same on this episode of Oculo Tokyo.
Free as I was meant to see.
So why is it that doctors are telling their patients it was a big success, even though we can obviously look at her videos and photos and see that it's not an outcome that anyone would want?
I think it's a difference of...
Hi everyone, it's Francesca. I'm the head of international operations here at Oculofacial Clinic Tokyo, and today I have Dr. Kashima with me.
Hi, I'm Tomoe Kashima, the Chief Director of Oculofacial Clinic. I specialize in orbit surgery and oculoplastic surgery and aesthetic surgery.
Thank you. So in today's video, we're sharing a case-based analysis of a patient who underwent orbital bone decompression surgery at another clinic and experienced an unfavorable outcome. So this patient has kindly given us permission to use her photos and videos for educational purposes today. So today our goal isn't to blame anyone or criticize, but to help people understand why orbital bone decompression is a very serious and irreversible surgery, and why outcomes can sometimes be very disappointing.
Yes. Okay.
So very simply, what is orbital bone decompression designed to actually do?
So orbital bone decompression is it's simply removal of a bone around the eye and the orbit. Orbit is a socket, the space of skull bone around the eye. And orbital bone decompression is just to remove the bone around the orbital space.
I see, I see. And originally, this was only for medical necessity, not for cosmetic purposes, right?
So orbital bone decompression causes enophthalmos.
Like a sunken eye.
Yes,
I see.
Yes. So for the patient of thyroid disease, it is good, to get back their original face, But there are so many demerits of that surgery.
Yes, and actually, so our case today unfortunately had a very unfavorable outcome. So I'd like to dive deeper into her case and see exactly what went wrong and how patients can protect themselves from having a similar outcome. So when you first look at a case like this after surgery, what are the main things that you can notice right away when you look at her photo?
She suffered from the very severe enophthalmos. And so when we got the message, I understand the condition totally from her photos.
What exactly is going on with her face after this first surgery? Can you explain what you see?
So previous doctor caused enophthalmos by doing the orbital bone decompression. She had too severe enophthalmos. And then the previous doctor did a revision surgery, second surgery, to treat the severe enophthalmos. And then inserted the plate to the orbit, but it doesn't work. She had too much bone removal. And that's why she was very difficult to treat that condition.
So because there was too much bone removed, it made it very difficult to reconstruct her face with the current methods available in her country.
Yes.
I see. In this case, is there anything anyone can do if there's no one in their country to treat them? What options does a patient have in this case?
She was treated by a very famous surgeon in her country. But after treating the enophthalmos, the result is not enough, right? So no one can do that surgery, revision surgery, reconstruction in her country.
So basically, there was nothing she could do in her country.
Yes.
I noticed that her eyelid shape has also changed.
Yes.
Well, I've learned from you that even when there's no surgery done on the eyelids,
Yes.
this orbital bone decompression can also affect the eyelids. But in her case, they did operate on her eyelids. Why did they do that?
Okay. So lid shape is different among the Caucasian and the Asian. So when I do orbital surgery, Asian have a very small lid crease, right?
Like a monolid.
Yes, monolid, yes. But in Europe or US, or so Caucasian have a very clear lid crease, right? And so the basic technique of the orbital decompression is from lid crease.
Oh, really?
Yes.
So in the West,
Yes.
they start from the lid crease.
Yes. Yes.
Oh, really?
And then, if the surgery continues very long, it causes scar tissue inside the eyelid. Yeah, that's why she have a too high lid crease, and it is because of the scar formation.
I see. So due to the scar formation, it caused the eyelid crease to heal in a position that's too high.
Yeah, too high, and also it causes too long surgery cause kind of swelling, and then the swelling make her eye as a ptosis, breathal ptosis. It's a descending upper eyelid.
So droopy eyelid.
Yes, droopy eyelid.
I see.
Yeah.
So even though she had a correction
Yeah.
to fix all of these things, it caused more problems for her.
Yeah.
I see. In this case, for patients seeking similar revision surgery, what kind of questions can they ask to prevent such outcomes from happening?
So from my point of view, the bone decompression have risks, and the patient have to know the risks. I'm a apprentice of very famous Professor Dr. Goldberg. Yeah, and he is inventor of some kind of bony decompression. Several kind of bony decompression surgery.
Several kinds.
Yes,
Oh, wow.
very famous. And the kind of most famous oculoplastic surgeon in the world.
Oh, really?
Yes,
Wow.
yes. So my mentor is him, and I can do the bony decompression. But now I don't do the bony decompression anymore.
Because of all of the risk.
Yes.
I see. So in her case, she was told to do bony decompression. And I think a lot of patients are told to do orbital bone decompression. Why is that?
Most of the surgery of the orbital decompression is bone decompression. Almost no one can do the other method. Only our clinic or the hospital in Taiwan can do the fat decompression surgery.
I see.
Yeah.
So there are really no other options around the world
Yes.
other than orbital bone decompression.
Yes.
So I see often that orbital bone decompression is performed with orbital fat decompression,
Yeah.
but never orbital fat decompression alone.
Only.
Oh.
Yes.
I see. And why is it not performed alone in other places? Is it just because they don't know the technique, or why? Even though they can already do it.
Orbit is very kind of dangerous tissue. Like around the eyes, there are so many important nerves, arteries, veins, and the muscles also. So it's dangerous to treat.
I
Okay.
see.
So removing the fat looks like a very kind of dangerous technique for us, like ophthalmologists, doctors.
Really?
Yes.
Wow, you make it look very easy.
Yes,
Yes.
because we do so many patients. So
Yeah.
it's kind of easy for me, but it has a reason. We use a microscope.
And this microscope is originally a dental microscope, right?
Yes. Of course, we are ophthalmologists, and we have the microscope for ophthalmologists, but it's not good for the orbital surgery or oculoplastic surgery. We need to tilt the head of the microscope. Microscope for ophthalmology is kind of fixed. The angle is fixed. Many neurosurgeons use microscope, but it's too huge, too big, and too expensive.
So that's why you found a good balance with the
Yes.
dental microscope.
Yes.
I see, I see.
Dental microscope is kind of cheap, and also can tilt. Yeah, very light and small. Yeah, it's good.
I see. So another big concern with orbital bone decompression
Yes.
is asymmetry and also irreversibility. So it can't be undone. And as in this person's case, their eyes are very asymmetrical after.
Yes. So on my side, the doctor's side, doing the orbital decompression surgery, we cannot measure the amount because we use forceps to remove the thin bone, and also we use a drill, and the bone become a powder, and we use a suction and remove it. So we cannot measure the amount. That is a big problem.
And that's what causes the asymmetry.
Yes, yes.
I see, I see.
So doctors want to make a symmetrical structure. So doctors want to do the same thing on both sides. But the patient sometimes have a asymmetry already before surgery. So maybe the doctor want to remove more bone from the severe side.
So then they don't know when to stop, basically.
Yeah.
And then
That's the
they
point.
overcorrect.
Yes.
I
yes.
see, I
That's the
see.
point. Yeah.
Okay. And also, we talked briefly about how inside the orbit there are muscles as well. And I noticed with her case, her eye isn't really moving so well, and she can't blink well. Why is this? What happened in her case that causes this?
Every orbital surgery have that kind of risk. So when doctors enter the orbit, it causes scar tissue. Scar tissue causes injury of eye movement and double vision. Especially the long surgery make more scar.
And that's very interesting because I know in a previous video we mentioned that many people think that a long surgery is good. Like it equals good quality because they took a long time.
Yes.
But actually taking a long time on orbital decompression surgery is very bad because it causes a lot of scar tissue.
Yes.
I see. So I think one of the questions that patients can ask is how long is the surgery time? For example, in your case, how long is surgery time when you perform orbital fat decompression surgery?
So orbital fat decompression, it depends on the patient, but usually it takes only 30 minutes for both eyes.
30 minutes
Yeah.
for both eyes. Wow.
My surgery is very fast, so it depends on the patient. If the condition is very severe, it takes 1 hour sometimes.
That's still very fast.
Yes.
I believe this patient told me that her surgery took about 5 or 6 hours.
Yes.
So that must be why she had a lot of scar tissue and restricted movement.
Yes.
I see.
So my mentor, Dr. Gorbal, do the bony decompression maybe in 40 minutes.
Oh, 40 minutes.
Yes,
oh,
very very fast.
Wow.
Yeah, he have a good hand.
Yes. So it really comes down to the skill of the doctor.
Yes.
I see. Okay. In many cases, the patients are told that their surgery was successful. And in many cases, the patient often feels like they're being gaslit. So she also felt the same. So all of the doctors told her it was a success, everything was good, but she didn't feel good. So why is it that doctors are telling their patients it was a big success, even though we can obviously look at her videos and photos and see that it's not an outcome that anyone would want?
I think it's a difference of the goal of the patient and the doctors. The goal of doctors is removing the bone. How to clearly remove the bone?
Yeah.
Okay.
Yes.
But the patient, the goal of the patient is different. They want to get back their pace.
Yes, of
Yeah.
course. Yeah.
That is the goal. So goal is different. Maybe.
She underwent orbital bone decompression
Yes.
surgery, and in most countries, it's the only type of surgery that's
Yes.
available. It's also very expensive.
Yes.
Yeah. So your surgery is a little bit different from that, right?
Yes,
You
yes.
you offer orbital fat decompression
Yes,
surgery,
yes.
and also, if I understand correctly, you created your own method of
Yes.
orbital fat decompression surgery. Could you briefly explain that
Yeah.
method?
At first, I have to explain about the disadvantage of orbital bone decompression. So, as we talked about it, we cannot measure the removal of the bone, the amount of the bone removal. So, it has a risk of overcorrection.
I see.
Okay. Second reason is skin scar. Bony decompression needs a skin scar. It makes an open wound and can make a very big scar. Third is the bone removal takes a very long time to recover. There's too much swelling and bruising. Yeah, because the bone removal.
Yeah.
Yes.
Very
But this disadvantage become an advantage of fat decompression. We make no scar on the skin, and we can measure the amount of removal of fat using the syringe. And the downtime is very short. It's like 1 week or something.
1 week.
Yes,
Wow.
yes.
That's very short.
Yeah. So immediately after the surgery, the patient have almost no bruising and no swelling.
Oh, really?
Yeah, even just after the surgery. Yeah.
If they have the local anesthesia,
Yes.
then they might have a little bruising from the local
yes.
anesthesia, right?
Mhm.
I see.
Yeah.
I see. But the surgery itself doesn't cause much bruising.
Not so much.
I see. Wow, that's amazing. This patient suffered a lot of mental anguish because of this surgery.
Yes.
And it's her wish that other patients don't suffer like her. So thank you so much for letting us use your photos and videos today. Lastly, so what should patients absolutely make sure of before they jump into orbital decompression surgery?
Of course, the patient should not rush into the surgery. So please check the doctor's order the CT scan before surgery to see the condition or bones. If the doctors don't explain about the risks, it's dangerous. And also the patients cannot see the real world, real technique or humanity or personality of the doctors. So the patients should see the comment of Instagram or Google Map or something. Yes.
Yes, I totally agree. Yeah. And I think also in this day and age, it's very easy to hide negative outcomes. And unfortunately, we see a lot of patients that
Yes.
undergo that at our clinic as well.
Yes, yeah.
And recently, we've been doing a lot of revision surgeries like her.
Yeah.
So it's really important that you check the comments, see the before and after photos, ask questions. Make sure the doctor is willing to answer your questions, and take your time. As he said, don't rush, because it could be a permanent, irreversible decision.
Yes.
So take your time and make an informed decision.
Yes. Agree. Yes.
Thank you so much for watching us today. And remember, orbital surgery can permanently change your anatomy. So we hope this discussion will help people make informed choices for their future. So if you like this video, make sure to subscribe for more eye-opening medical insights. See you next time.